Hi, today we're going to be talking about tonic-clonic seizures based on our patient Misty's diagnosis. My name is Jordan Myers.
My name is Madeline McDougall.
I'm Sadie Tucker.
My name is Julie Garrido.
All right, so just a little bit of an overview of our patient. Misty is a 24-year-old nursing student who started to feel unusual before she fell to the ground. She is responsive and tactile to verbal stimuli, but is confused about the event and is oriented to name and place, but not to time of day. The patient's classmate essentially suspected a tonic-clonic seizure based on symptoms of loss of control, unconsciousness, arched back, muscle spasms, urinary incontinence, dilated pupils, and the seizure lasted approximately 45 seconds. They gave her diazepam and a loading dose of phenytoin upon admission to the ER, and the patient also denies a history of seizures. The healthcare provider also did an EEG and a CT after he did his mental status and neurological exams. The EEG did show brainwave abnormalities, which led to the diagnosis of the tonic-clonic seizure diagnosis.
So some basic pathophysiology of seizures. Seizures are abnormal, uncontrolled electrical discharge of neurons in the brain. It's sudden and excessive. It can result in an altered level of consciousness, as well as altered motor abilities, sensory abilities, and altered behavior. Brain tumors can sometimes cause seizures, or abnormal electrical neural activity, or imbalance of neurotransmitters.
Some risk factors and preventative care for seizures are, the risk factors include age, family history, a previous head injury, stroke, vascular disease, dementia, or a brain infection. And some preventative care include taking medication as prescribed, avoiding alcohol, practicing stress management, maintaining a consistent meal schedule to avoid hypoglycemia, avoid flashing lights, and protect your head from head injuries. Tonic-clonic seizures can be caused, like Chanel said, by an imbalance between excitation and inhibition of neurons, which can be caused by brain tumors, brain trauma, an overconsumption of alcohol or drugs, going through withdrawals, a hypoglycemic state, or stroke. It usually occurs in patients with epilepsy and lasts 1 to 3 minutes. A tonic-clonic seizure has 4 stages. The first stage is the aura stage, and it can include some symptoms like hallucination, confusion, dizziness, or numbness. Then the second stage is tonic stage, and this includes a stiffening body, so your muscles become stiff and you arch. The third stage is the clonic stage, which includes contraction of your muscles. And then the fourth stage is called the postical stage. And at this stage, the patient is weak and sleepy and exhausted from the seizure.
So some of the common nursing diagnoses that we can use for seizures are risk for injury related to loss of consciousness, risk for physical trauma related to cognitive limitations, risk for falls that can happen as a result of their decrease in muscle tone. 2 others could also be impaired physical mobility and impaired urinary elimination, as the patient in our scenario had urinary incontinence. For some areas to focus on for documentations when it comes to seizures, we really want to record the time the seizure began and the time that it ended. We'd also want to know how often the seizures occur, for example, like the date, the time, and the duration of the seizure. And we also would like to know if there's more than one type of seizure occurring. Some of the findings you'd want to do on the assessment, you'd want to list like the level of consciousness, the movement and the progression of motor activity. You'd want to know how long it takes for the patient to return to their pre-seizure status, and other observations, like for example, are they lip smacking, or are their eyes fluttering or blinking excessively?
Some diagnostic assessments of seizures include the EEG, which they did in the previous situation. explained, and that test measures brain electrical activity, and they can detect the origin and the type of seizure. A CT scan or an MRI provide an image of the brain tissue and can be used to identify potential causes if they see a tumor or scar tissue or blood vessel damage. A PET scan uses radioactive glucose to show the blood flow in the brain and how the brain metabolizes sugar. So that could indicate if it was caused by a hypoglycemic event. And then a neurological assessment also used in the situation, used to assess cognition, strength, sensation, reflexes, walking, and coordination. And this could be used to identify weakness patterns in a patient.
Right, so the patient was prescribed 2 drugs, one of them being Dilantin or phenytoin, 100 milligrams. It was a loading dose, which basically means that they want to achieve the therapeutic effects of the drug quickly. It's an anticonvulsant that essentially helps diminish seizure activity. Some of the common adverse reactions would be acute toxicity, which occurs if the patient is given more than 20 micrograms per milliliter. Slurred speech is an example of the acute toxicity, something that can manifest. Other adverse reactions include cardiac arrest. Cardiac arrest is more likely if a person has cardiac disease already. Acute hepatic failure, aplastic anemia, angioedema. So we would educate our patient on swelling in the mouth and stuff if after the medication is administered, and then bone marrow suppression. Some of the drug-to-drug interactions would include antacids, which actually decrease the absorption of the oral form of the medication. Things like alcohol, benzodiazepines, salicylates can increase serum levels of the drug. And then phenytoin can also decrease the effectiveness of oral contraceptives. Some of the food and drug interactions would include folic acid. Absorption is decreased here, and St. John's wort, which can decrease serum levels of the drug. And then for carbamazepine, she was given this as well, 200 milligrams. It's specifically meant to help with like muscle spasms and decrease her seizure activity, essentially. Some of the adverse effects or reactions would include a granulocytosis, which essentially means that neutrophils are below 100 microliters in the blood, hepatotoxicity, pancreatitis, thrombocytopenia, and suicidal thoughts. And then drug-to-drug interactions include MAO inhibitors, which can cause pyrexia, which is essentially an increase of the body temperature above 106, hypertension, seizures, and in severe complications, death. And then it can also decrease levels or effectiveness of acetaminophen, estrogen-based contraceptives, and CCBs. And then there's an increased risk of toxicity that can occur with using ciprofloxacin, erythromycin, and isoniazid. Isoniazid also specifically increases the risk for the hepatotoxicity, which was talked about earlier. And then as for food interactions, grapefruit juice is contraindicated because it increases the serum levels. And yeah. So some of the major complications of the tonic-clonic seizures include status epilepticus, SUDEP, which is sudden unexpected death in epilepsy, physical injury, sleep disorder, bone disease, and cardiovascular disease. The status epilepticus is a neurological emergency. It's defined pretty much as a seizure lasting more than 5 minutes over 30-minute intervals, which can lead to brain damage and metabolic problems such as the hypoxia, hypotension, and hypoglycemia. For SUDEP, the cause is unknown. And then physical injury, sleep disorders, and bone disease can actually manifest indirectly from seizure medications. Nutritional deficiencies can decrease nutrient absorption. Oh, scratch that, I'm sorry.
Okay, so for client education for seizures, many clients will have an aura before their seizure. So it's sometimes like a ringing in the ears, they're seeing bright lights or something that happens every time before their seizure, and it's the same thing. So they can sense a seizure coming on. I would educate a client to notice their aura and then indicate safety measures. So get somewhere safe, sit down if they're standing, if they're able to lie down or have their head on like a pillow or something soft, as well as to let their loved ones and people they're around most often know about their seizures and what to do in the case of a seizure. So they want to lay on the floor, clear the area of anything that they could harm themselves with while they're seizing. Most importantly, educate your friends, family members, coworkers not to stick anything in your mouth while they're seizing. It could cause a choking hazard and could obstruct the airway. If the patient does vomit while they're seizing, it's just important to roll them on their side if possible to make sure they don't aspirate on their emesis. And then as for dietary changes, no grapefruit juice. And it's important to monitor your serum blood levels. Many patients can build a tolerance to their medication, and so they're constantly having to change their dose of their medication. So making sure you're going to your lab appointments. For the next slide, I'm talking about the integration of new knowledge into nursing practice. So this is rather complicated, but a new study came out of the UVA Department of Neuroscience talking about microglia. So previously it was thought that microglia cells cause seizures. Their role wasn't necessarily known, but they were present during seizures. And this new study in 2020 found that microglia were actually indicative of preventing seizures. In some, they were found to maintain brain homeostasis and calm overstimulated neurons and clean up the extra neurotransmitters that could cause seizures. So there's more research to be done in this, but it's definitely something in the future that we'll learn that will help stop seizures. And here are references.
Thank you.
Thank you.
Bye.